health and nutrition. So definitely, like maybe because of lack of basic amenities or clean drinking water, or maybe overly dependent on traditional medicinal system, their superstitious beliefs and practices, their health is grossly neglected, and you can see high prevalence of TB, leprosy, anemia, diarrhea, and other maternal related diseases, infant mortality rates, maternal mortality rates, and lifespan is generally lower among tribal people in comparison to non-tribal people. And again, as I said, there is a close nexus between all these problems what we have studied, like lack of education or unemployment or maybe poverty or all these things, along with health and nutrition, isn't it? So please write some basic information related to health and nutrition. Health and nutritional levels are poor among tribal communities in India. There is high prevalence of TB, leprosy, anemia, TB, leprosy, anemia, diarrhea, sexually transmitted diseases, nutritional deficiencies, maternity related diseases, high maternal mortality rates, neonatal and infant mortality rates, and low lifespan. Next paragraph. The causes of poor health and malnourishment include over dependency on traditional medicinal system, superstitious beliefs, next shyness of contact with communities at large, shyness of contact with communities at large, next intoxication, consumption of country made liquor, tobacco products, drug abuse, etc. Isn't it? Next, lack of proper infrastructure, which include primary and secondary healthcare centers, primary and secondary healthcare centers, that I will write after this. Primary and secondary healthcare centers, lack of quality medicines, proper diagnostic measures, next difficulty in deploying doctors, paramedics, nurses, ashas, and other administrative staff in tribal areas. Even reluctancy of these staff, tribal area, reluctancy of these staff members to work in tribal areas. Reluctancy of these staff members to work in tribal areas. Yes. Next, lack of basic amenities, clean drinking water, sanitation, hygiene, lack of education, awareness, etc. So these are the main issues, measures, suggestions. Again, here also you can write market generation gap. Please write market generation gap exists with respect to health and nutrition. Therefore, awareness should be created by means of folklore, mass media, folklore, mass media, and with the help of technology. Next, instead of totally alienating the traditional healers, a culture sensitive way of taking their help in delivering modern healthcare services is needed. Next, the traditional knowledge of tribal people on medicinal benefits of plants and animal products should be documented and these intellectual property rights should be protected. Next, the primary healthcare centers and secondary healthcare centers should not be on a national model, but should be redesigned to meet the tribal needs. Next, doctors, paramedics, and other staff should be recruited locally based on merit and who are fluent in local dialects. Tribal people, next point, tribal people who become doctors should serve the tribal areas for at least 10 years. 10 years. Because many people do not actually prefer to work in tribal areas. So next, tribal medical colleges. Medical college should write like that. Medical colleges should be established. Medical colleges should be established in tribal areas. And proper infrastructure should be developed. Like hospital buildings, diagnostic measures, availability of quality medicines, availability of medicines, etc. Yes. NSSO, census, and other organizations should collect timely and reliable estimates, on various health indicators in tribal areas. One percent of the budget from tribal subplan should be allotted to collect these estimates. 1% of the total budget from tribal subplan should be allotted to collect such estimates. Next, the stringent provisions of National Excise Policy 1976, the stringent provisions of National Excise Policy 1976 should be strictly enforced by the states. Next, the sale of liquor, tobacco products, and other intoxicants in tribal areas should be strictly monitored. As these addictions have serious mental effects, on tribal people. So these are some suggestions related to health and nutrition.